Since February, we have been working hard to reach a contract settlement with the union representing 4,800 registered nurses who work at our metro hospitals. The primary barrier seems to be reaching an agreement around our health insurance. Our goal is to make sure that we have a sustainable health insurance plan for our nurses without compromising upon our commitment to provide the nurses exceptional insurance coverage. In doing so, we fulfill our commitment to being wise stewards of our resources. I've had direct conversations and emails that number in the hundreds by now, and I want to use this opportunity to say a few things and to answer many of the great questions that have been posed. I especially want to do so to make certain that our shared mission and vision is never lost, that appreciation is expressed for all who serve our patients and community so well, and that the facts of our proposal, and not rumors or incomplete truths, are what nurses consider as they vote on August 18th. So, questions. Why is Allina Health the only Twin Cities system addressing this problem? For this reason, the other metro hospital systems don't offer the same nurse-only plans as Allina Health, and were able to settle their contracts for wages only in January of this year. During this past decade, we've tried many times to work with the union addressing the skyrocketing costs of the nurse-only plans. Despite attempts to do so, we have been unable to make any significant changes to these plans, resulting in increasingly high premiums for our nurses and even higher ones for Allina Health. We could no longer delay addressing the health insurance issues. So why the nurse-only plans? What's the focus there? What's wrong with those? So much has changed in healthcare in the last 20 years, and the nurse-only plans have not changed to reflect the current state. Things like convenience care didn't even exist when these plans were originated. We work every day to help our patients get the right care at the right place at the right time, but the design of the nurse-only plans mean that the very coverage we offer our nurses doesn't necessarily support that goal or support healthy lifestyle choices. The nurse-only plans have high premiums in exchange for things like no deductibles and very low or no copays for most services. Because the plans lack alignment for people to choose cost-effective care options, people end up using care differently. In comparison, today's plans have lower premiums, and the participants share in the cost of care they receive. So more people are apt to choose convenience or primary care for minor ailments instead of going to the urgent care or to the ED, for example. What's at risk if we don't solve the cost problem now? Well, costs for the nurse plans continue to grow unchecked. It's a problem for the nurses and for Allina Health. Nurses will continue to pay more in high premiums without a corresponding increase in value received. The disproportionate cost paid by Allina Health to maintain the nurse-only plans will crowd out other critical investments in our care. Those investments include making sure that we have the right facilities, the right medical equipment, and actually support our talent in the right way and maintain jobs needed to support patient care. Why is a union telling nurses and community members that the plans put them at risk for financial ruin? I honestly don't know. More than 30,000 people are well covered by these plans, and an independent analyst hired by Minnesota Public Radio has shown that they offer Gold Plus level coverage and are more generous than what employers typically offer. The union has also agreed to these plans for hundreds of nurses it represents at 3 of our facilities. Here's another question I've heard. People say, I've heard other employees have different health plans. Why is Allina Health going after the nurse-only plans if that's the case? I've also heard a lot of misinformation, so let's clear up a few things. All other employees are offered the core plans with the exception of 14 pharmacists on a standard plan that was discontinued a few years ago. We'll be working through that plan with them during their contract negotiations later this year. The union has claimed that executive leaders and physicians at Allina Health have a special plan. We don't. They've claimed that we don't pay the same as other non-contract employees. We do. Their claim that the SEIU has a different plan is also misleading. SEIU represented employees have a 2014 version of the Allina First plan, which doesn't include updates yet we made to avoid the Cadillac tax. None of our other employee groups have 20-year-old health plans that continue to increase exponentially in cost each year. Another questions I've heard. I have students out of state and I travel. What if something happens and I need care there? While the core plans do offer incentives for nurses to choose Allina Health because we're proud of the care that we provide and our partner facilities, there are more than 2 million in-network providers nationwide to choose from. Even our competitors are in-network. If you have an emergency that lands you or a loved one in an out-of-network facility, your costs will be covered at the in-network rate. Even if you are admitted as a result of a trip to the emergency room, you're covered. So why should I consider Allina Health's proposal? We significantly modified our health insurance proposal in an effort to reach an agreement. While our preference is that all of our employees be on the same core plans, we made a compromise that would give existing nurses the option to stay on choice and advantage plans if they would help take a larger share of the escalating plan costs. As it is today, no changes to the Advantage or Choice plans can be made without agreement between the union and Allina Health. And contrary to what's been said, Allina Health will continue to pay a fixed and generous percentage of the premiums on the core plans as we do today. Negotiations are not a winner-take-all situation. While we wanted to discontinue the nurse-only plans by a set date, we made a compromise that we thought would be a solution that would work for our nurses and for Allina Health and leave the choice of the plans more in the hands of the nurses. We sincerely hope our nurses give this proposal serious consideration instead of moving to a strike that benefits no one, not our nurses, not our 21,000 other employees, and most importantly, not the patients or the communities we serve. Retaining the 20-year-old plans without addressing the cost issues of those plans, it's not something that we can agree to, and a strike of any duration will not change our position on that because the change is necessary. These plans are simply unsustainable and will not carry us to the future in a reasonable way. In closing, I urge our nurses to review the proposal and the information about the core health plans. Much has been said about both that is not true or incompletely so. Given the stakes that go with a proposed open-ended strike, it's really critical that all of our nurses vote with the facts at hand. We all have meaningful work that we're doing together to improve the lives of the patients and the communities we serve. We want to make sure that we can do so long into the future for the next generation who relies on us for their care. To do so in a way that we can work together and to make sure that we have benefits that sustain people and help support, ultimately, pride and joy in the workplace is something we're committed to as an organization. We look forward to a time when these issues are resolved so we can focus again on the care for our patients, our communities, and for each other. Thank you very much.